Hello, everyone. Welcome to the Foundation for Healthy Kentucky's Health for a Change webinar, Kentucky's Children, Important Health Policy Updates. Thank you so much for joining us today. We have a fantastic lineup of speakers. The Foundation for Healthy Kentucky's mission is to address the unmet health needs of Kentuckians. We do that by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. The Foundation for Healthy Kentucky values integrity, respect, effectiveness, leadership, policy equity, and collaboration. This training series, Health for a Change, began in 2011, and its goal is to support the health advocates across Kentucky and to highlight their work and to also learn about best practices. And again, today we're talking about health policy. I'm honored to have worked and collaborated with many people across Kentucky. You can find the upcoming schedule and the archive of past events on the Foundation's website, healthy-ky.org, under the Events tab. I do want to let you know to please mark your calendar. Our two May events, our webinars. The first is on data sharing and HIPAA. As many of you may have known, as soon as folks start talking public health and health data, HIPAA is the next word in line for that. Please join us on Tuesday, May 4th, a webinar with an expert from the Network for Public Health Law who will be talking all things data sharing, HIPAA, and also the issues brought to the forefront because of COVID-19. On May 19th, we'll be talking all things 2020 census, and we'll be able to talk with the U.S. Census Bureau partnership expert for Kentucky, and also the director of the Kentucky State Data Center. So as you know, the reapportionment numbers just came out this week for the 2020 census, so we're thrilled to speak with those two experts on Wednesday, May 19th. Another save the date, annual Howard L. Bose Memorial Health Policy Forum, which is the Foundations for a Healthy Kentucky annual forum, will be held virtually this year on September 20th and 21st. The title for that event is Kentucky Vaccine Policy, Myth, Messengers, and Messages. You can check out all things Bose Health Policy Forum at the Foundation's website under the Events tab. If you aren't already familiar, I want to introduce you to the Foundation's Kentucky Health Coalition for Healthy Children. The Foundation is a backbone organization for the Kentucky Coalition for Healthy Children, which has a steering committee of 32 organizations and is a strong public-private partnership. The Kentucky Coalition for Healthy Children works to promote policy, programs, and practices in the school setting to improve health and well-being of children and youth in the Commonwealth. Children spend a large portion of their lives in school during ages when there are critical changes taking place, and the school settings offer opportunities to address health and education inequities and offers children and youth the opportunity to foster their strength, resilience, and potential. For more information about this coalition, please check out their website, KentuckyHealthyChildren.org. And there you can email the coalition coordinator, Amalia Mendoza. Again, my name is Rochelle Seeger. I'm very honored to have been working for the Foundation for a Healthy Kentucky since 2013 as the Community Health Research Officer. We have a fantastic lineup of presenters today, experts on children's health policy. We have Kelly Whitener, Dustin Pugel, and Emily Beauregard. I'm thrilled to welcome as our first presenter today, Kelly Whitener, Associate Professor of the Practice at Georgetown University, McCourt School of Public Policy's Center for Children and Families. Welcome, Kelly. So glad you're here with us today.
Thank you. Thank you for having me. I'm excited to be here with you all. As Rochelle mentioned, I'm with the Georgetown University Center for Children and Families. We are a nonpartisan policy and research center in the McCourt School of Public Policy at Georgetown University. And I'm going to start with a little bit of context setting today, and then get into more of the kind of current events of the health policy landscape right now, with more of a focus on what's happening nationally. And then Dustin and Emily will give a little bit better sense of what's going on at home in Kentucky. Let's see. Okay, so at the Georgetown Center for Children and Families, we spent a lot of time focusing on Medicaid, and that is because of this pie chart, really. It is the big player when it comes to public coverage for children and families, serving even more children, a larger share of children if you look by income and other demographics. So it's really the MVP in the room when you're talking about coverage for children. Long-term research has shown that Medicaid coverage as a child helps improve health outcomes as kids and later in life as adults. This is also true for pregnant women. So some of the highlights here are from a literature review that my colleague Edwin Park wrote for the Commonwealth Fund that pulls together all of the different peer-reviewed research around the impact of having Medicaid coverage for children and pregnant women. And as you can see, it improves health over time. And this is something that, of course, we would want to see because it is a healthcare program, but it doesn't actually stop there. Medicaid coverage for children and pregnant women actually improves educational attainment too. So it's a great return on investment to make sure that kids and pregnant women are covered and have access to needed care. We also know over time, we've learned that when Medicaid coverage numbers are up, the uninsured rate goes down. And that really speaks to how expensive health insurance coverage is. So if you're not eligible for something that is affordable, you're likely to remain uninsured. So when Medicaid coverage is up, the uninsured rate goes down. But unfortunately, we saw the uninsured rate in the last few years for children going in the wrong direction. And this came after really decades of progress with covering more and more kids following CHIP coming on the scenes in 1997. And getting kind of an infusion of cash in 2009. And then following the ACA, you can see that steep decline in uninsured rates for kids nationwide. But starting in 2016, that trend reversed. Which was very alarming to see, but we did actually see it coming because this data comes from the Census Bureau. There's always a lag. So in the fall, they're releasing data from the prior year. And Medicaid enrollment data comes out a little faster. There's a lag there too, but it's not as big of a lag as with census data. So with Medicaid enrollment data, we are already seeing Medicaid enrollment declining, which made us believe that we would see the uninsured rate increase, and sure enough, we did. And just in case that little slope ticking up doesn't seem like a big deal, it really is. It's a 1 percentage point increase over 3 years, which amounts to 726,000 more uninsured children over that time period. So it's really a bigger deal than maybe that line graph indicates. Now here you can see how Kentucky compares to the national average in terms of uninsured children. And over this time period from 2008 to 2019, Kentucky has consistently done better than the national average, which is great, something to be proud of. But you can see that the line kind of follows a similar pattern. So when the national average was going down, so did Kentucky's. And then likewise in the past couple of years when it's ticked up, so has Kentucky's. So here you can see from 2016 to 2019, the uninsured rate for children in the state went from 3.3% to 4.3%, also a 1 percentage point increase, which amounted to an increase from about 35,000 uninsured children to about 45,000 uninsured children. And all of this is actually before 2020. We all know what happened in 2020. I don't want to spend a lot of time on that. Would rather think about what we can do going forward. But I'll just say that this was the year where everything got turned on its head. And now in 2021, there's a lot of opportunity and potential for change. We have a new administration. We have Democratic leadership in the House and the Senate. But these are on just the slimmest of majorities. In the Senate, it is actually the slimmest possible majority, with Vice President Harris having to step in to break a tie as needed. So, there's a lot of potential. There's a big agenda from the new Biden administration, but there's also, I think, a high likelihood of continued gridlock in DC. So when we think about what the Biden administration health agenda is, and how that fits with the legislative agenda too, there's a long list of things. So thinking first about the, excuse me, the right-hand side of this slide, you can see there's a ton of issues that the administration and the new Democratic majorities want to address. Some of them very large and complicated, like climate change, immigration policy, racial equity, and the list goes on. There's just so many things that they want to get done, and limited amount of time, resources. So there's always trade-offs. When you focus on one, it's hard to get to the other. On the health side of the ledger, it's also a long list, and this is where we spend most of our time thinking about these policies. Of course, the top priority across the board is COVID-19 response, and we've seen that in 2020 and in 2021 with a lot of legislation and administrative actions to try to address the pandemic, and I think that will continue. We've also seen a real interest in trying to expand access to coverage, trying to make sure more people have health insurance coverage, and that takes on a little bit different shape depending on your state and where you are. So in states that haven't taken advantage of the Affordable Care Act's Medicaid expansion to cover more adults, there's a real emphasis now on trying to fill that coverage gap. There's also an emphasis on pregnant women and wanting to make sure that women are covered before, during, and after their pregnancy in order to improve maternal and infant health outcomes. And there's an emphasis on making marketplace plans more affordable because, as I mentioned, for the most part, when people are uninsured, it's not because they want to be, but because the plans available to them are just too expensive. So we've seen a lot of action in that space. More on the administrative side, I think there will be a really big emphasis under the Biden administration on Medicaid demonstration waivers, or 1115 waivers, as they're sometimes called. This will include unwinding harmful waivers like imposing work requirements, and also exploring new ideas to think about how coverage can continue to innovate, how Medicaid can meet today's needs. I also think there will be an emphasis on Medicaid oversight overall, making sure that states and managed care plans are complying with federal rules. But I want to spend a little bit deeper dive on some of these healthcare issues and come back to public charge over the next couple slides here. So when we think about what's happened already on COVID relief bills, there are a lot of pieces that relate very directly to Medicaid. So starting first with the Families First Coronavirus Response Act, which was actually passed in early 2020. States got an extra 6.2 percentage points in their federal matching payments, also known as FMAP, for Medicaid costs. So this is pretty common when we are expecting an economic decline. Congress often steps in and increases the FMAP. And in exchange for doing that, they typically require some type of maintenance of effort so that states don't just scale back their own investments, but maintain their investments and use those federal funds to do more. What was different about the Families First Coronavirus Response Act is that the maintenance of effort requirement actually included a new piece that there would be no disenrollment throughout the public health emergency. So anyone who was enrolled in Medicaid when the public health emergency started last year, or who has enrolled since then, should stay covered through the duration of the PHE. And that is really new. I think it's directly in response to a pandemic. It would be a very bad time for people to lose health coverage. And it's been really helpful in making sure that people do maintain that coverage. But I will say that we are worried about what unwinding that requirement will look like. So I'll come back to that in a moment. The American Rescue Plan that was passed in 2021 also includes some Medicaid changes. There's a 5 percentage point increase for non-expansion states. Those are the states, unlike Kentucky that I mentioned earlier, that haven't taken advantage of that option from the Affordable Care Act to cover more adults and Medicaid. So there's a lot of money on the table to try to encourage those states to join. There's also a 10 percentage point increase for home and community-based services. This is available to Kentucky and to all other states. The state just has to make some type of an improvement to their HCBS services, and then they can draw down this much higher federal matching funds. It is short-lived, it's time limited just from April of this year to the end of the year. So it's good to take advantage of that quickly. The American Rescue Plan also included a new state option for extending Medicaid and CHIP postpartum coverage from 60 days to 12 months. And then I won't really spend a lot of time on either of these. They're not in my Medicaid lane, but they're very important. They enhanced premium tax credits for marketplace plans has helped make those more affordable. I saw in this morning's news that this is something the Biden administration would like to see continued as part of their American Families Plan. And similarly, the child tax credit and earned income tax credit increases, we expect to see just major improvements on child poverty as a result of those policies. But Dustin will be able to speak more to those. Then turning to the public charge issue that I know folks on the phone or on the line are interested in hearing about, and has been a big part of my work for the last several years. I thought it'd be helpful to kind of think of it in terms of a timeline because there's just been so much change here. So if you remember back to August 2019, that's when the Trump administration finalized new public charge rules. And the new rules did a couple of things that would have made it harder for people to get green cards. They changed the test. Instead of being primarily dependent on public benefits, they changed the test to really likely to receive, so it was a much lower bar. They also expanded the list of benefits that would be considered, and imposed a new totality of circumstances, as it's called, test that really emphasized wealth over everything else. So those new rules were finalized in August 2019, but temporarily blocked by the courts. There were lots of lawsuits all over the country. So those rules were blocked for September 2019 to January 2020 when the final remaining injunction was lifted by the Supreme Court. And so then the Trump rules went into effect from February 2020 to March 2021. And in March 2021, just last month, there was kind of a series of events that happened that resulted in returning to the 1999 field guidance on public charge. So this is where we could spend a whole webinar talking about all the different steps that the Biden administration took. It was a concerted effort from the Department of Justice and the Department of Homeland Security. We're now seeing the Health and Human Services Department also issue more guidance about how this rules has changed. But the result is that we're back to the 1999 field guidance, which for the public charge test means that it's really returning to looking whether someone is likely to be primarily dependent on government programs, in particular cash assistance or long-term care funded by Medicaid. So this will take us back to a test that allows for more people to gain green cards, particularly family members of people who are already here and already have that status. Sorry, I was getting a phone call. I don't know if that's interrupting my audio. I hope not. And returning to the 1990 field guidance will also mean no longer having that emphasis on family income and wealth. So now to think a little bit about what some of the policy opportunities are in Kentucky, I broke this out into two different categories, thinking about Medicaid overall, and then thinking in particular about what Kentucky could do to help immigrant families. And on the Medicaid overall list, some of these things I would identify for every state. So this could mean Medicaid overall in a couple of ways. Primarily in that group, I would say improving state oversight of managed care plans. Most states do rely on managed care plans to deliver care in Medicaid. And it's really important to continue to do oversight over those plans to make sure that the state is getting what they're paying for. And it's hard work to do. I think it requires concerted effort. It requires having staff in the department and agency that are able to continue do that work. Sometimes when managed care plans come in, staff shrink in those departments. So it can be really hard to maintain that oversight role, but it's super important. Next, and I would flag this for all states too, is to proactively update beneficiary addresses. This is something that links back to that note I made earlier about how, as a result of the maintenance of effort requirement, people cannot lose Medicaid coverage for the duration of the public health emergency. When the public health emergency is over and states have to unwind all of that, it's possible that families have moved around a lot. We know that economic impacts of this pandemic have been really intense, unevenly distributed. So addresses may be wrong, and it would just be so terrible for eligible people to lose their coverage because of things like outdated addresses. So we're really encouraging states to try to update those now and work together with managed care plans to make sure that they have the most recent contact information for all the beneficiaries enrolled. And then for a handful of states still, there's a need to adopt the 12 months continuous coverage option in Medicaid and CHIP. Over half of states have done this already. I think this would be a great move for Kentucky to make sure that you can reduce churn, that kids, once screened and enrolled, are able to stay enrolled for an entire year. I also mentioned the home and community-based services, 10 percentage point increase in federal funds. I think that's really important to take advantage of now, to identify an improvement that the state can make in order to qualify for those funds and make sure to get, as much of that money as you can. It also will free up state funds for other uses. So you don't have to make an improvement that's going to cost as much as the money you're bringing in, if that makes sense. So it could be kind of a net win for the state. And then I mentioned too the option from the American Rescue Plan to extend postpartum coverage for 12 months. This is something that a lot of states are interested in. We've seen 3 waivers approved along these lines in Illinois and in Georgia. Georgia's is just for 6 months, not for the full 12. And then in Missouri, although Missouri's is really focused just on women with substance use disorder needs, so not as expansive as Illinois or Georgia. But just since this option became a real thing in the legislation in March, and it goes into effect actually next April, we've seen 5 states appropriate funds for it already and expect to see another 4 before legislative sessions wrap up. So this is definitely something that's gaining steam. On the immigrant families side, there's a lot that can be done here too. I noted waiving the 5-year bar for lawfully residing pregnant women. I think that would be a great move for Kentucky. Also, in relationship to the COVID-19 pandemic specifically, Kentucky could clarify the definition of emergency Medicaid services to include COVID testing, treatment, vaccines, and that would help people who meet the Medicaid eligibility requirements except for their immigration status to be able to access those needed services. I think it's also important to do some PR and informing families that the Trump era public charge rule is no longer in effect. There's been a lot of confusion about the rule over the last several years and its implications. And so there's a lot of work to be done to explain what the current law is and what it means for families. And it really means a lot when the state themselves does this. Same when the federal government itself does it. We've seen research from the Urban Institute that shows that, especially in immigrant families, people really want to see that government seal to know that the information they're getting is reliable. And then finally, the state could adopt the option to cover prenatal care for women who are otherwise ineligible for Medicaid due to citizenship status. It's another state option that actually comes with CHIP match. So with that, I will just turn over to some of our resources here if you want to learn more about our work. Of course, our website, we also have our Kids Healthcare Report Card, which shows Kentucky-specific data. And we've recently launched a Medicaid Learning Lab where you can learn about the different components of Medicaid. That'll be ongoing series, and the prior webinars are also posted on our website. So thank you, and I'll pause there and turn it over to Dustin.
If I can figure out how to unmute myself. Well, thanks, Kelly. And for those of you who are not super familiar with the Georgetown Center for Children and Families, they are a really incredible resource with very smart and dedicated folks that I have reached out to many, many times. I know Emily has as well. So I encourage you all to take Kelly up on her offer to use those resources that they have available on their website, and to reach out to them because they're really great people who know a lot. My name is Dustin Pugel. I'm with the Kentucky Center for Economic Policy. We are a research group based here in Kentucky out of Berea, although we have folks in Louisville, Lexington, and Midway as well. We are a nonpartisan, nonprofit research group that focuses on state policy and seeks to enact public policy that improves the lives of all Kentuckians, especially low-income and middle-income Kentuckians, through better evidence-based policy. So today I'm going to sort of zoom in on recent policy changes here in the state, and mostly on what happened during the General Assembly this year, because there was a lot of movement on a lot of different bills that I think had a pretty profound effect on, or will have a profound effect on children's health here in the state. So it's going to be kind of a survey, a drive-by look at these things. So I encourage you all, if you're interested, when the slides go out, there are links to each of these bills embedded in the slides, so you're welcome to go look on your own time. So I just wanted to start with a graphic that I'm sure everyone is familiar with. It's one of my favorites. It's from the Kaiser Family Foundation, really describing social determinants of health, because I think it's important to, when we're zooming out and thinking about what has affected children's health recently in policy, we have to look at the full picture. So what are policies that affected economic stability, the environment that kids live in, their education, their access to good, nutritious and affordable food, what's happening in their social context, and then finally, what is happening in healthcare. So, these are each, I think very critical components of what makes all of us healthy, and kids especially. And so when we're looking at bills that were passed this session, it's good to use a lens of health in all policies, because there really aren't policies that get passed that don't affect our health and well-being in some way. So with that, we'll go right into bills that passed, that started in the House, and this is sort of an arbitrary setup that I put together, but I found it easier to walk through in this way. So just starting out, House Bill 50 was a bill that really strengthens parity between care for mental health as compared to care for medical health or physical health, if you will. It does this in several ways, including by requiring insurance companies to, not limit the types of treatments that people receive for mental health any more than they would for physical health, and reporting regularly. So really what this does is it takes and builds off of what was passed in the Affordable Care Act several years ago, enshrines it at the state level, and reinforces it through some extra policy. In general, I think that's a really good practice that Kentucky should continue to do with other types of patient protections in the Affordable Care Act. There have been bills the last 2 years that take a whole suite of patient protections and seeks to enshrine those into state law. And those have not gotten hearings, but I think it's good to continue moving at this pace, especially as we have seen lately, the Affordable Care Act is not invincible. With the lawsuit California v. Texas and others, it's really vital that for us to protect Kentucky kids and all Kentuckians' health, that we really adopt those same protections here at home. The next is a cap on out-of-pocket costs for insulin. I'm sure everyone has either been on a webinar or heard or read a report about how expensive insulin has become in the United States, and Kentucky is no exception. So this is a bill that essentially requires that for folks who are privately insured in Kentucky, and this doesn't include self-pay insurance, so it's actually a sort of minority of privately insured folks in the state, that if they need insulin, they've been prescribed insulin, they pay no more than $30 for a 30-day supply, which is very good. That's actually one of the lowest caps in the country. I think there's only one state that's lower, $25, I believe, in New Mexico. So it's a really important protection for folks who need that really life-giving drug. The next is House Bill 212. It's a bill that added race and ethnicity and income data on reporting on child and maternal mortality rates. And it also requires that that information be presented to the legislature so that they have really good evidence to then build policy on to try and protect folks, both children and mothers during childbirth. House Bill 382 is really historic in some ways. Up till now, Kentucky has not had funding for full day kindergarten. There's been funding for half day kindergarten for years, but full day is something that usually the local districts have to pick up the tab for. So this provides funding to cover the entire day of kindergarten. That's only true for 1 year. So it's going to be important next year as the legislature is putting together a 2-year budget that continue to move forward. House Bill 405 added $12 million for an increase in the Child Care Assistance Program for reimbursements to child care centers. I think a lot of times we hear about that and it's not all that exciting, but we have really experienced a massive decline in child care centers in the state between 2013 and 2019. We slid from 4,400 to 2,200 child care centers throughout the Commonwealth, and now over half of the state population lives in what's called a child care desert, where there is either no capacity or not enough capacity for the number of kids that require that. So adding a little closer to a market rate for children who are in childcare through the Child Care Assistance Program means that in areas, especially in rural Kentucky, it will be more economically viable to open these centers and keep them open so that we can put kids into high quality childcare, which of course we know has massive impacts on them right away, but also later in life. There's some studies that show longitudinally that it affects them even out to age 40. And then the last is House Bill 497, which does several things related to reentry from prisons and jails. The one that I want to focus on is it ends a ban on SNAP benefits. It also actually ends a ban on TANF benefits, KTAB, basic cash assistance, for anyone who has had a drug-related felony conviction in their past. We've had a modified ban for a long time in Kentucky, and this ban has actually been in place since the '96 Welfare Reform Act. So this actually moves us back to a place where your qualification doesn't depend on your prior history, and that's really important for parents who are coming out. But as everyone knows, when you reduce the food budget for one person in a household, you reduce the food budget for everyone in the household. And we know from state data that there are a lot of households who have been affected by this ban in the past where children are present. And when there's not enough food for kids, that creates a lot of problems. So ending that ban was a really big deal for Kentucky and for Kentucky kids, and we're really excited and grateful for Representative Mosier bringing that forward. Okay, moving over to the Senate. The first is a bill that offers outpatient mental health services for homeless youth. Before, there had to be essentially like a parental write-off to allow that to happen. But when you are homeless and you're under 18, that becomes a very difficult thing to do, especially if the reason you're homeless is because you have a strained relationship with your parents. So this allows kids to be able to receive that treatment without having to have parental sign-off. Senate Bill 32, it was actually originally filed as Senate Bill 36, and then Senate Bill 32 got used for something else. And so Senate Bill 36 got used for a different policy. So they switched it over to Senate Bill 32. Essentially what it does is it ends automatic juvenile transfer to adult court for juveniles who have been arrested for a felony that is related to a gun, where a gun was present, essentially. And this gives judges, prosecutors, and defense attorneys more leeway in deciding whether or not this individual needs to be tried as an adult. So that's really important because having a felony conviction in adult court really creates a lot of hardship on them and their families, and just being in jail is a health crisis all its own. So that is a really important step, and I'm grateful to Senator Westerfield for bringing that forward. I think the second or third year in a row. The next is Senate Bill 51. It bans insurance companies from requiring prior authorization for drugs that treat opioid and alcohol addiction. That is, again, I think very helpful in making sure that when someone is ready for treatment, that treatment can be brought forward immediately without delay, because delays can create too much space for people to either continue to use and potentially overdose or relapse. So as soon as those folks are ready for treatment, that those drugs should be ready and available for them moving forward, which is good for parents and obviously good for their kids. The next is a bill that brings back a policy that Kentucky had briefly that requires the state to drop food assistance from folks who are behind on their child support payments. Now, I want to be upfront and say that I think child support is a really helpful and effective tool at reducing child poverty. I think it's a really important part of our ability to make sure that kids thrive and are healthy. But when it comes to this particular policy, evidence has shown that taking food assistance away from folks doesn't actually increase their adherence to child support payments. And that's by and large because folks who are on food assistance have such little income that they qualify for it. So it's not like removing food assistance actually ends up improving their ability to make good on their child support payments. And in fact, what we've seen is that in the little over a year that this policy was in place, over 6,000 kids were in households where food assistance was taken away. And again, that for the same reason the SNAP drug felony ban reversal was a good policy, we're concerned that this could inevitably lead to some hardship. Now, there are exemptions for the way the state has sort of brought this new piece forward. There are now exemptions for households where children are present, and we think that was a really good move as far as child health goes. We're still concerned about households where there are not children, but there are other people present. So, and just people in general, because again, I think taking food away or taking money away that helps pay for groceries is really never going to be useful to anyone. And then the last is a bill, Senate Bill 84, which improves conditions for pregnant women who are incarcerated. It makes sure that they're not going to be put in solitary confinement, or that they're not going to be restrained in potentially harmful ways. It also allows new mothers to remain with their children for 72 hours and have very quick and regular access to social workers to make sure that once they are out, they are able to go back to be with their kids. All right. So this is technically a House bill, but I wanted to treat it separately, which is just our state budget. So folks may remember that last year, because of COVID, the General Assembly passed a one-year budget instead of the normal biennial budget, which we typically do. I think that was a good call. No one really knew where things were headed. We weren't sure what was going to happen with revenue. But what ended up happening is that largely because of bills like the Families First Coronavirus Response Act, the CARES Act, and the December relief bill, we ended up in a much better position than we thought we were going to be. And that was before the American Rescue Plan Act was passed, and a large infusion of money, both on the direct side of things, with money going directly to the state and school districts and local governments, but also in larger revenues due to the stimulus check and other direct assistance. we ended up being in a pretty good position with the budget. Before the American Rescue Plan Act was enacted, we knew we were going to have about a $600 million surplus. And so there were a lot of opportunities to use that money for assistance for folks and to actually fill a lot of holes that have been left from about a decade of austerity. Instead, what the General Assembly decided to do was to essentially pass another continuation budget and put almost all of that money, that extra money that we had accumulated over the last year, into the rainy day fund. So for the third year in a row, SEEK, which is the core funding formula for our education, K through 12 education system in Kentucky, was stuck at $4,000 per pupil. And of course, if you factor in inflation, that means that it's been declining for at least 2 years. The governor proposed putting extra money in textbooks. The General Assembly zeroed that out. There was $5 million less for preschool. That $5 million had been used for coordination grants between childcare centers and local public preschools to try and create full day preschool opportunities. And so they backed that down to the $82 million that is the sort of core preschool funding. There were no new social workers. The governor had asked to create over 70 new positions for social workers to reduce caseloads and increase the quality of casework in the state. And they added no new funding for that. There was no new funding for Michelle P. or SEL waiver slots, which are Medicaid programs for people with intellectual and developmental disabilities. A lot of those are kids. And so we still have a waiting list of about 10,000 people, many of whom are children, who are asking for those services and are not going to get them anytime soon. There was no new extra money for libraries and archives. Libraries have been, their funding has been pretty stagnant for a long time, and there's a lot of good research showing that if you fund services like libraries, you end up improving the health of the communities that those libraries are centered in. And like I said, they took the entirety of the extra money plus a little extra and added $743 million into our rainy day fund, which will be helpful at some point. But I think the argument is salient that we are in a really difficult situation right now with about 1 in 4 adults reporting having difficulty, actually 1 in 3 adults reporting having difficulty paying their bills, 1 in 4 adults saying they don't have enough food to feed their children with, 1 in 4 renting households saying that they're afraid they're going to get evicted in the next 3 months. There's a lot of really dire need, and we didn't use the budget this time to do that. Now, there is a lot of extra American Rescue Plan funding that is coming soon, I think. We're still waiting on Treasury guidance on how to use that. They've allocated a large chunk of that, but in terms of state general fund dollars, there were a lot of missed opportunities this session. Unrelated to the session, I just wanted to quickly talk about the expanded child tax credit in the American Rescue Plan Act. Folks may have seen that there's a proposal to extend this through 2025 in the new American Families Plan that the president has presented recently. I'm sure he'll talk about in his address to the joint session of Congress tonight. But just very quickly, I think this policy, more than most other policies we've seen in the last decade, is a game changer for children and especially for children's health, because there's just an amazing amount of research that shows cash and near cash assistance has a really important effect on children's well-being, both immediately, but also later in life. And so this is the first time that the United States has really put together something like a universal or close to universal child allowance. I'm sure folks have heard about it, but it changes the child tax credit in 4 sort of big ways. The first is that it increases the credit amount from $2,000, which it's only been for a couple of years now, up to $3,600 for children under 6 and $3,000 a year for children 6 to 17 per child. So this could really add up for families with multiple children. It removes the income floor. So previously you had to be earning about $2,500 a year to even qualify for this credit. This takes it all the way down to 0. So that extremely low income families who are more likely to be disabled or have been recently laid off and having a hard time finding a new job. This provides a really incredible benefit for them. It provides some income. So it's sort of essentially a wage floor for parents with children in the household. It makes the entire credit refundable. So Prior to this, only $1,400 of the credit could be sort of given back in a check above and beyond what someone owed for their taxes. So this makes the entire amount, of $3,600 or $3,000 per child refundable for folks who don't owe taxes beyond a certain amount. And then finally, it provides half of this benefit in what was written as periodic payments. Folks have been saying that these will be monthly payments. I think that would be ideal, but given the IRS's capacity right now, it's possible it may be quarterly or could be bi-monthly. It's just not really clear yet, but it will be periodic. The other half will be available when families file their taxes next year, 2022. So that way, if they, it basically evens out in case they owe or they don't. Now, families who owe, who earn below, I think it's $40,000 a year, they will never have to pay back any of that, even if they do owe some taxes. So the American Rescue Plan Act did put in some safeguards to ensure that very low income families wouldn't end up having to pay this back. The other really important thing, I think, for this session is to point out that these folks, when they receive this credit, it will not affect their ability to apply for programs like SNAP and Medicaid. This is a tax credit, so it's not seen as income. It's seen as basically a return of income earned already. So this money will not affect their ability to get food assistance, other types of basic cash assistance, medical assistance, and so forth. And I think that's really important. So what does all that mean? It means that over 1 million kids in Kentucky are going to benefit from this. 69,000 children are going to be lifted above the poverty line, which is almost half. It's 49% of the number of children who live below what's called the supplemental poverty measure. And it's going to inject $1.8 billion into families and into the local economy, which will then, of course, spread and grow the way that any kind of spending does. So this is a really important thing. It's also important to point out that folks should file their taxes. There's still, I think 20 days now for folks to be able to file their 2020 taxes so that the IRS knows which children you have, where you live, and how to get that money to you. So later in the year, there will be a portal for folks who have children during the year or who have a situation where they need to claim custody of a child, whereas maybe it was divided before. That portal is not live yet, obviously, but it should be soon. So with that, I'm going to go ahead and wrap up and hand it over to Emily Beauregard. And I'll take questions at the end if there's time.
Great, thank you, Dustin. I hope everyone can see my screen. My name is Emily Beauregard. I'm the director of Kentucky Voices for Health, and we are a nonprofit, nonpartisan coalition of consumer health advocates working to improve the health of all Kentuckians through policy advocacy. We have a focus on lifting up the voices of Kentuckians in the decisions that affect their health, and also in promoting policies that are equitable and just for all Kentuckians. We are grantees of both the Foundation for a Healthy Kentucky and the Georgetown Center for Children and Families. So really pleased to be part of this webinar today and to work with these fantastic people. As Dustin said, that Georgetown Center for Children and Families has been just a tremendous resource to us when we are doing our policy analysis and looking for opportunities to improve children's health in Kentucky and access to care, removing barriers to health insurance and coverage. And working with the Foundation for a Healthy Kentucky, we've been really thrilled to be part of the launch of the new Coalition for Healthy Children. So lots of exciting work going on that we've gotten to be a part of. And today, Rochelle invited me to share just a couple of updates with you. So the first really kind of is wrapping up everything that you've heard today about the American Rescue Plan Act and how it's helping Kentuckians. Just earlier today, we got a final version of our new explainer, and we're working to promote 6 ways that ARPA, the American Rescue Plan, directly impacts and benefits Kentuckians. You heard many of these today from Kelly and from Dustin. And we wanted to make sure that Kentuckians knew what direct benefits they are eligible for and how to get them. So that's what this explainer is meant to be. We have a companion FAQ to go along with it. We created this explainer in partnership with our Thrive Kentucky Coalition. Dustin and the Kentucky Center for Economic Policy are members. And we also partnered with the Cabinet for Health and Family Services. So our goal is to get this out as far and wide as possible. It would be fantastic to have your help in sharing this with your networks, making sure that every Kentuckian knows what they're eligible for, how to get it, where to get more information if they need it. So what you'll see here is an image of that explainer, a link at the bottom that goes to the explainer and the FAQs, and I'll drop a link in the chat as well so that it's easier to get to. The only other update that I wanted to share is that we lead quarterly forums with the Cabinet for Health and Family Services. And our next forum is on May 4th at 2 p.m. Eastern Time. We will be focusing on a number of topics, but generally our forums are meant to create more open dialogue between cabinet leadership, consumers, and advocates. We focus on getting people the latest information on the state and federal landscape in terms of COVID-19 response and relief. We also share updates on safety net programs and what's changing with safety net programs, who's eligible, how people can apply and get that assistance, what barriers exist that we need to continue working to break down. And then we try to make space for feedback and for comments and questions so that the cabinet has a better idea of what advocates and consumers need and can be more responsive to those needs in their work with us. So the topics that we have for this coming forum are the implementation of 2021 legislation that Dustin just ran through, federal relief and state budget impacts, health equity, what the cabinet is doing internally related to health equity, the special enrollment period on the marketplace, healthcare.gov, and plans to reconnect Kentucky's state-based marketplace with our Medicaid enrollment, which is very exciting. We're having a Connect reboot in October, if you haven't heard. And also the status of COVID-19 vaccinations. So I hope you can join us for that. And I will now turn it back to Rochelle.
Emily, thanks so much for sharing the updates with us this afternoon. I do want to remind all the participants that I will send you the link to the recording and also the slide decks from our presenters today. I will send that to you this afternoon via email. Also, there'll be a link to the post-event survey. I'd be very happy if you would take 3 or 4 minutes to send the feedback about today's webinar and also send your ideas for other webinars that we can put in the Foundation for Healthy Kentucky's Health for a Change training series. Immense gratitude to our presenters today for sharing their expertise with us. Please check out their websites and learn more about Center for Children and Families, Kentucky Center for Economic Policy, and of course, Kentucky Voices for Health. Lots of call to action. If you aren't already a member or know about the Kentucky Coalition for Healthy Children, please also check out their website to learn more about and join that efforts to improve the health of Kentucky's children. Reminder that all of these recordings and upcoming schedules are available at the Foundation's website, healthy-ky.org. And thanks to each of you for joining us here today. This concludes today's webinar.